Hi everyone, time now for the CURES show, where we explore the cutting edge of mind, body, and spirit wellness. And we've been talking a lot about Ozempic in the news, all over the headlines for the past several months. A lot of people might be trying this drug. It was originally for patients with type 2 diabetes, for weight loss. There are some other ones out there. But what about natural options? Are there supplements or things in nature that could really help regulate your appetite and encourage weight loss? In fact, the answer is yes. So we're going to talk more about this with Naturopathic Doctor and expert in integrative medicine, Dr. Jennifer Stagg. Thank you so much for being here.
Thanks for having me.
So let's talk about Ozempic, Wegovy, all these first. I mean, they're literally selling them now at med spas, and I think we all know people who are losing tons of weight on them. What's the downside, or what's your concern?
Yeah, so certainly there are a lot of success stories, and I have patients in my practice who are using it. The concern, I would say, certainly is it's expensive, first of all. So a lot of people are needing to pay out of pocket for it and can't afford to pay like $1,000 a month for a medication.
That's a lot.
Yeah, it's not covered by insurance for obesity. You would have to have a diagnosis of type 2 diabetes in order to get it covered by your insurance. So it's costly. So first, that's often why patients come in and see me and say, like, are there any alternatives?
Yeah.
But then there's certainly a concern of safety concerns and risks of adverse effects, and the weight loss that happens with those classes of medications. A lot of it, up to 40% of it, can be muscle mass that you're losing. So it's not all fat, and that's a big concern metabolically, because wasting muscle, which is easy to do as we age, if you have a medication that exacerbates that muscle loss of aging, that's terrible.
Right, because not only is it going to hurt your metabolism a long time, but could it be more of a risk for falling and things like that?
Yes, and your immune system, there are a lot of risks from what's called sarcopenia, for sure. And then there are other side effects, like people with digestive problems, nausea. Some people can have something as severe as pancreatitis or gastroparesis, which is like paralysis of the gut. So there are serious side effects, adverse events that you would want to, take into consideration before starting a medication like that. It doesn't, come without risk.
The bottom line is it's only prescribed anyway right now for type 2 diabetes. So if you're going to a med spa and getting an injection, which I know some people are, and they're asking, how do I get Ozempic? There are risks.
Yeah, absolutely.
And it's costly. So we want to talk about, are there things that really work? And in fact, there are things in nature. There's something called berberine, which is sort of like nature's Ozempic, I guess.
Kind of, right. And it's been around for a long time also. There's a long history of use in naturopathic medicine and integrative medicine, but there's also a lot of clinical data that supports berberine too. So you can find plenty of articles with clinical trials, even trials that compare it to metformin, which is another common diabetes medication.
So I'm holding berberine in my hand. This one is made by Metagenics. You could Google that. I know it's available in your practice. This is not for prescription. However, you don't want to just buy any berberine. If you see it at the local drugstore or something, you're not going to get the same clinical results that you're getting in your practice if you just get random berberine.
Right, very likely. You really want to buy berberine from a really good quality manufacturer, because we know there have been a lot of issues with quality over the counter, that it might not even contain berberine, first of all. It could have something else in the capsule, or it doesn't even have enough milligrams, the dosage might not even be adequate.
So full disclosure, I'm trying this because I did some blood testing that it wouldn't be done in my standard office, but it showed that at least by optimal levels, which is what you look at, I have some insulin resistance.
Yeah, exactly.
And that doesn't mean I'm diabetic, but it does mean it might be a reason why if I have a bagel, it's going to come on, and if I have carbs, I'm going to gain weight faster.
Right. It makes you kind of carb intolerant as a way to think about it, that you're not processing those carbohydrates very well, and also then you're not, you're having issues with fat metabolism, where you can't burn fat effectively. You're sort of tipped more into the direction of fat storage, is what elevated insulin does. So when you take something like berberine, it helps improve that insulin sensitivity, and it helps ultimately then with glucose control. It does help with cravings too. So just like the medications like Ozempic, that a lot of it is a reduction in appetite, we see that also with berberine.
So if you want to pick up berberine, and I know you do this in your practice, but if someone wanted to try this, how would they use it and how do they know if it's okay?
Yeah, so we tend to use a supplement that has about 500 milligrams per capsule, and then typically the dosing is 2 to 3 times a day. A lot of times we'll start out with twice a day, and you would take it with a meal. And that's similar to the dosing that's used for metformin, and it's been compared milligram per milligram with metformin, and it works just as effective.
Okay, what if you're already on something like metformin? Then should you not do this?
No, it's okay. Like I've had patients where we add on berberine along with metformin, and we'll still see some results where there's improvement in appetite and some improvements in insulin sensitivity.
So how do we know? What will we see? What would be the positive results of adding berberine to our diet to see, I mean, how long will it take to notice if it's helping us?
Yeah, I mean, within the first month, people tend to notice that their appetite is a little bit different, like they're not just always hungry. And it does also, we'll talk about the next supplement, but this particular supplement, berberine, increases a type of bacteria in your gut called Akkermansia. So it also is having that effect, and that can help control appetite and work on that same pathway that Ozempic works on. But then people will start to notice that they're having some weight loss with it, and then certainly with blood testing, that's where we start to see a lot of great benefit, is looking at things like glucose and hemoglobin A1C and insulin.
Okay, so in your practice, you're noticing after you add the berberine and maybe some other things, and that doesn't mean you go eat fast food every day. You're still going to need a healthy diet.
Yep.
But when you're adding this in, you're watching people clinically after a few months, you retest them, and the insulin resistance has improved.
Yep, absolutely. And even cholesterol levels too. So there's a lot of data on cholesterol for berberine too. So when we're looking at a whole cardiometabolic profile, we'll see changes in a lot of those different markers in the blood, and we tend to test more so like 3 months out after starting. Now,
just to be clear, when we go to our regular physicals, I get my A1C tested, I'm fine. Insulin resistance isn't something that is generally tested in conventional medicine.
Right, exactly. Like you'll rarely see an insulin tested. It's usually if you see someone in an integrative medicine provider. Like on a standard physical, you'll only see a glucose level. You won't even typically see a hemoglobin A1C. Sometimes your doctor might run one of those if your glucose is starting to elevate a little bit, and certainly for diabetics, they're run routinely.
Okay, so this is something that you would ask for, and you know, my insurance covered it. After doing stories with you, I went, I didn't know about it, but my levels were a little high. Not anything that conventional medicine would worry about, but something that would be affecting with, okay, as I'm getting older, why can I not have, why is it affecting me so much? And so does this happen to women a lot too, as we're going through those years of, you know, late 30s, 40s, into the 50s, where people are noticing weight gain? Is that part of the problem?
Right, it's really common. That's one of the first things that we'll include as a test for people who come in and say, oh, I'm gaining weight, I'm sort of doing the same sort of exercise and diet that I always did, now all of a sudden I'm gaining weight. We would always include an insulin, a hemoglobin A1C, and then of course we'd start looking at hormones and adrenal function and cortisol and things like that.
So just so we understand, insulin, because people hear about this and they'll say, oh, what are you, diabetic? Insulin sort of is one of those, it's a hormone, and if it's out of whack, it causes us to store fat.
Yep, exactly. So insulin is needed to get glucose inside of cells. So when you eat carbohydrate, it's broken down into the smallest molecules, glucose, what we would call our blood sugar. And then that needs to actually, like glucose needs to get inside of cells. And in order for that to happen, those cells need to bind to insulin. And what happens is the receptors on those cells become sort of resistant to the effects of insulin, so it doesn't bind very well anymore. So then over time, glucose is not going to get inside the cells, and then it starts to rise in your bloodstream. But insulin is also hanging around out in your bloodstream too and elevating, and that causes inflammation. It causes a whole host of side effects basically from high insulin levels on their own.
So we don't want that.
No.
We do not want that. Okay, so berberine, Metagenics is one of the brands you like. There are other ones out there.
Yeah, there's a lot of companies that make really good berberine supplements. Biotics makes a great berberine supplement. There's Connecticut-based companies, Designs for Health.
Designs for Health.
Like a lot of them make berberine supplements.
So now we're going to go to the next thing, which is we've talked about this on the show before, probiotics for mental health, probiotics for weight loss. There's a lot of talk about probiotics right now that if we improve what's going on in our gut, kind of affects everything else. But this specifically is a probiotic you're prescribing for your patient to kind of help with that extra weight and belly fat and all that. And it's called Akkermansia?
Yeah, Akkermansia. So this is sort of brand new. This product just is out like in the last month. So we're really excited about it. It's a European-based product. There's a lot of research on it already. So we're seeing in some smaller preliminary clinical studies that without changes in diet and exercise, people are just taking that supplement and losing fat. And that's really key here, is that it's fat loss only, as opposed to something like Ozempic is causing some muscle loss. This is specific for fat. And the type of bacteria this is, we would call it a probiotic in that category. But when people are overweight or meeting the criteria for obesity, the levels of Akkermansia in their gut decline. And so we've always wondered, can you replace that and see some clinical benefit? And it turns out yes. And this is one of the first ones kind of to show that effect.
So it's a funny word, Akkermansia, Akkermansia. And like, again, do you want to just go out and Google Akkermansia and buy it online? No.
Right, yeah. So this one specifically, it's a proprietary blend, of course. It has green tea extract, it has biotin in there, but the type of Akkermansia in there is actually pasteurized, and it's compared to another Akkermansia on the market, and it works like twice as well, basically. So it does matter what you purchase, obviously.
And this is produced.
This is Metagenics.
It's Metagenics, but it's called the Akkermansia company.
Yeah, so they've partnered up with a European company, and that's been on the market there for 2 years in Europe.
Okay. And so in Europe, people are taking this and noticing a difference. So what you're doing with your patients is having them do berberine and Akkermansia.
Yeah.
And this you take at night with a meal?
Yeah, so it's just like one tablet you take with this particular Akkermansia. That's just one a day, and then berberine could be 1 to 2, and that really, 2 to 3, and that really needs to be with a meal.
Okay, right. And I've noticed when I have started taking this berberine, again, this isn't like instant that you're just going to go, oh my gosh, I lost 5 pounds. I mean, it's not like that.
Yeah.
But I have noticed that it's kind of strange that I'm staying full longer.
Yep.
I always was one of those people who need to eat every few hours. You know, I get a little shaky, which would be an indication probably that my insulin's a little off, you know?
Absolutely.
And I'm still trying to make sure I eat healthy and have protein in a meal, like, you know, all that kind of stuff. But I just noticed that I can go longer. I was never one of those people who could go a long time without feeling kind of hangry.
Right, and that is because of insulin resistance and kind of it will cause erratic blood sugar levels. So you're having those dips, and then when you have that dip in blood sugar, it makes you hangry.
Makes you hangry, right. Okay, so I think my hangriness has improved.
That's good
and
news.
then if you're gonna take a probiotic anyway, which a lot of us are being recommended to do, this is just specific that this strain is going to help us.
Specific for weight loss.
And that's new to people, but like, why does it matter if I take a probiotic? How's that improving my metabolism?
Yeah.
Without having to go all the way through med school, why would a probiotic improve our metabolism?
Yeah, so it actually, what happens in your gut is sort of a center of where everything kind of happens. And so that also is improving insulin sensitivity and ultimately like glucose management too. And that works through this same pathway, GLP-1, that Ozempic and Wegovy, those medicines work on. So it's the same sort of pathway. So this is something that obviously naturally happens in your body, but when you use natural supplements, you're not going to run that risk. Like certainly you're not going to lose 40 pounds in 3 months taking a supplement like that. But over time, you'll lose weight instead of continuing to gain, right? Like most people are on a trajectory of gaining. So if you lose weight at a consistent pace over time, you'll eventually kind of get back to where you were.
Does this heal you? Can you stop eventually, or do you just stay on berberine and akkermansia? Not that I guess there's not side effects generally, because it's most people tolerate it. It's a natural thing. But do you just do this for a period of time?
Well, yeah, it depends on what your weight loss goals are. So I would say a lot of people that are coming in are looking to lose 20, 30 pounds. So it's going to be a little while to get there. And taking those long term, there's certainly no problem with that, but you could probably get to a point where you might not need it because you've sort of retrained your insulin receptors, like they've gotten a little bit more sensitive again, and you're probably continuing to eat a little bit better and have gotten better sort of control with your diet too, whereas, a lot of people could get away with things for years and then they realize they can't.
Right. Like we watch our kids just eat like Chick-fil-A all the time and like, how are they not gaining any weight? They have better insulin receptors.
Yes, exactly.
Okay, so it's not just like the fact that when, kids are growing, it's even like in our 20s when we say, okay, we could eat whatever and it didn't bother us. Yeah. We got a little older and our hormones aren't the same, and that's why we're putting on fat more.
Right. So this will kind of get you back on track, and you're eating healthy along with it. And then over time, yes, if you're meeting your goals, you don't need to take those forever.
Okay. Yeah. So let's talk about this next thing. This is a test. Interesting. Microbiome Test Kit from Standard Process, which is another really good company that natural doctors use.
Yeah, absolutely. So this particular test was developed by a microbiome researcher, actually a Candida specialist, Dr. Mahmoud Ghannoum. He's at Case Western. And so this is his company called Biome. And the methodology here is really top of the line in terms of being able to accurately sequence the microbiome in your gut. The benefit of this particular kit is it's really inexpensive, so it's only $129, which is pretty cheap when it comes to microbiome tests. The other thing about it is that it's an easy collection, so it's what's called a fecal swab. So it's just like a Q-tip and you're getting some fecal material off of like toilet paper, as opposed to having to collect your poop, which a lot of people don't like to do. This is like an easier, I would say, compliance level to convince people to have their microbiome tested.
Should we do this? In your world, should we all have our microbiome tested, or what are we going to learn if we do that?
Yeah, so just like we talked about, akkermansia can be a class of bacteria that can be low, and this test can show that. You don't have to have that test done in order to take akkermansia, but it also tells you, like, yes, do you have some level of candida overgrowth? Like, do you have enough of the good bacteria in your gut? Do you have too much bad bacteria? And then perhaps you may need to do another sort of supplement program to sort of balance out the bacteria in your gut. So when it comes to metabolism and just overall health, we know microbiome is really critical there. So that is something that we definitely look at in patients who are coming in for weight loss.
And if you're someone listening to this or watching this, you're probably into health. And so candida, the candida diet, a lot of people know that. So if we've been on a lot of antibiotics, or you're having too many sugary foods, that you might have that candida imbalance.
Yeah.
It also can cause acne and other things, right?
Yeah, absolutely. And this is very sensitive. That's the other thing about this test, because it was developed by a candida expert. It's very sensitive for picking up candida. So even in the last month, I've picked up a couple of cases of very severe candida overgrowth. And now we can address it, but you would never know otherwise.
Right.
Yeah.
And how, just now, that may not affect weight loss, or maybe it would, but how would you treat that?
Yeah, so in terms of treating that, you can use like natural antimicrobials to treat candida. So there are a lot of different options that you can use. Oregano oil, garlic. There are a lot of really great blends for treating candida. And then certainly there are antifungal prescriptions that you can do.
Like diflucan.
Yeah, diflucan, like once a week for like 4 weeks.
So if you're a female having a lot of yeast infection issues, this could be a game changer.
Consider having that done.
Okay.
Yeah.
The other thing that you might have seen on your internet, and I have done this, and I've done stories on it, but it's on your table right now, the Prolon Cleanse.
Yeah.
Developed by a world leading expert in longevity.
Yep. Yeah. So there's so much great science behind this program, and it was, as you mentioned, developed as a longevity program, but it also helps burn fat during the program, and also improves some of these cardiometabolic markers. And you do not lose muscle mass on this either. So it basically is a 5-day program, and the research on it is you repeat that program, the 5 days, once a month for 3 consecutive months. And now they've done a little bit more research and they're saying 4 months. But over that time frame, the data shows a 4% reduction in BMI, and that's all coming from fat mass. And then also improvements in insulin and glucose, just like what we've been talking about here. But it is like, it takes a little bit of work to comply to it. It's a pretty intense 5 days, but I have had patients who are really stuck, like especially a number of women who are perimenopausal, postmenopausal. We've tried a lot of different things, and this has been a game changer for them.
Okay.
Yep.
So just to give people a little idea, the one thing I liked about this is you don't have to worry about food at all. Everything comes in packets, but it's created, I mean, it's all natural, like good stuff. And you just add, like there's soups, I do like soup, there's some olives. Yeah. There's not a lot of food, okay? But the idea is you're in it's a fasting mimicking diet, so you're eating stuff that they've researched. Your body thinks it's fasting. So it goes around and it cleans everything up and it resets everything.
Exactly. So the whole program, as you mentioned, is a fasting mimicking diet. So instead of going on a full fast for 5 days, which is not recommended, the foods in here basically trick your body and your body thinks it's fasting. And so by day 3, you will get into this process called autophagy, and it basically cleans up your old cells and cellular debris. And what will happen as a result of that is that your metabolism works better again. So even like in between Prolon fasts or a 5-day program, your body chemistry is working better again. So it is more of sort of a reset.
So, and back to, you know, the risks with Ozempic, besides the fact that it's really expensive, and I think most people that are doing it are like, okay, I've tried everything. But they may not realize that, hey, you can try these things. They
probably haven't tried everything.
Yeah, because these are things that if you are an integrative doctor, a functional doctor, people will say, just in case it's new, okay, are they a real doctor? You'll hear that, okay. So you went to med school like everyone else. The med schools that a naturopathic doctor would go to are the only med schools that are really trained in this level of prevention.
Right, exactly, that are actually getting this training. We get trained in pharmaceuticals and naturopathic or natural supplements approach. And there are certainly other types of healthcare providers that have training, but it's postgraduate training. Like they would have went to medical school or PA school or nursing school, and then they're going back and doing postgraduate training to learn about this. But in terms of actual just like basic medical education, you're right, naturopathic doctors are the only ones that get this as a core.
Which is always shocking to me because of course, you know, and you're not against taking medications, and sometimes I know you'll be like, hey, this is great if you're not having a problem with it. And you would keep in Connecticut, other states you would prescribe medicine, but in Connecticut, only MDs can. So you would keep your MD, but MDs in general wouldn't have taken that much nutrition or that much the idea of what's the root of the problem. It's usually more, let me fix the disease.
Yeah, it is. It's just there's differences in philosophy and training for sure.
Okay, so this is a lot more about wellness. And what about, you know, there's a lot of talk about cravings. And I know one of the things you said, the risk of Ozempic is that there's some reduction perhaps in serotonin or dopamine or things that help us focus and feel good. But why are cravings such a part of obesity and eating? Like, why do we?
Yeah, so a lot of it, like it is hormones in the gut. So not like your hormones like estrogen and progesterone. A lot of it is some of these hormones like what's called GLP-1. It's glucagon-like peptide. It's a mouthful. But that's what Ozempic works on. And then the cravings are reduced. As I said, Akkermansia works on GLP-1 as well.
Okay.
So a lot of it is that, but also the bacteria in your gut can cause you to crave sugar and crave foods that fuel their growth. So the bacteria in your gut, your microbiome, releases peptides that go to your brain and causes you to have like food-seeking behavior for foods like that contain sugar, basically. So if you have an altered microbiome, it will
you'll crave
basically
more.
create like cravings.
That's why
from
when
the
we kind of are on
bacteria
a good diet for a while and we maybe are eliminating sugar and all this, and then you're like, fine, and then you
Yeah.
add it back in.
Right,
you're
and
like,
you're like, oh.
you want more. Okay.
Yeah, yeah.
So let's, in our last 5 minutes together, these are things, but again, we've said you still want to have a healthy diet and exercise. But if you're trying things and you're like, well, I am eating healthy, but, and you don't want to be so extreme, we're like, I can't even have rice anymore. Every time I'm eating a sandwich, it's, you know, those kinds of things that you just notice it's changed. What would the diet be? What do you eat?
Yeah, so in terms of diet, we mostly recommend essentially a modified Mediterranean diet. And if someone does have like elevated insulin, that we're finding that on blood work, or certainly if they're pre-diabetic, we would probably then advise even a little bit more of a reduction in the carbohydrates. So there would be more of what we would call a modified Mediterranean diet, while we're working on sensitizing those insulin receptors by adding on things like akkermansia and berberine to allow them to be able to get to a point where they can tolerate carbohydrates better again. But in those initial phases, there is definitely a reduction in the amount of like starchy type of carbs, not necessarily like vegetables per se, which obviously are mostly carbs,
people don't think it's like no carbs, but in fact, fruits and vegetables are carbohydrates.
Right.
But you would be, if you're having this insulin sensitivity, or insulin resistance rather, you would want to eliminate your rice and your sweet potatoes, your French fries, like all that kind of stuff.
Reducing starchy sort of root vegetables, reducing greens, especially obviously processed grains. We would want to get rid of those completely. And then the grains that someone would be having would just be whole grain, and then a small amount of it also.
Yeah, so what's like typical?
Like a third of a cup cooked to half of a cup cooked.
For the day?
Well, at a sitting, but probably, yeah, like that would be maybe with dinner or would be at lunchtime in terms of those starches. And then obviously combining that with vegetables and protein and healthy fat.
Yeah, okay. So like, what about intermittent fasting?
Yeah, intermittent fasting is kind of interesting. More and more, we're seeing that intermittent fasting needs to be more so, like you should not be skipping breakfast, that you could disrupt glucose and insulin metabolism by going too long in the morning without eating.
Better to
But you
stand
can
early.
cut off early, avoid that evening eating more so. So maybe have an earlier bedtime to give digestive and metabolic rest. Certainly intermittent fasting, there's lots of success stories with that, but I have also seen the reverse where people didn't have elevated glucose and they start doing intermittent fasting, their glucose levels start going up because they're not eating till 1 o'clock.
Yeah.
So, you know,
you gotta be careful.
We just switch around the timing then. Pretty much.
So women especially, we can get a little more sensitive. We can kind of like our cortisol can go up when we're not eating as much.
Yeah, and it can cause that disruption then in that insulin and glucose signaling in the morning.
So if you want to do this, what's the bottom line? What would you recommend? I mean, obviously Whole Health Wellness Center is in Farmington.
Yep.
You can make an appointment with one of your practitioners, but let's just say, you know, is it fine to go get some Metagenics berberine and order the Metagenics akkermansia and just try it and see how you do for a month?
Yeah, absolutely. Like those are products that are very safe to use, have really great safety profiles, and certainly for berberine, a long history of use. So they are pretty safe to take.
Okay, and these are not nearly as expensive as Ozempic. They're not inexpensive. I mean, this is about $50, I think, the probiotic.
Yeah, I think that one might be closer to $65, and then berberine tends to run like $40-ish.
Yeah, so that's for a month, but you know, so you're, I guess, but if you're noticing that it really changes things and you can actually lose some weight. I don't know, for me, I've just started this, but I do notice it's strange. Like I don't crave sugar as much.
Which is like, that's the uphill battle, right?
I think it's hard to say no to all the good food in the newsroom, but this helps. Okay. All right, Dr. Jennifer Stagg, and you can follow her at Dr. Stagg, S-T-A-G-G, on Instagram. And I will also post this at Kara Sundland, so follow me for more information to be well. Have a great day, everyone, and be well.